Welcome to the Dr. Jim Cares podcast with Dr. James Augustine, where we provide powerful solutions for helping you create wellness. The following discussion is for educational purposes only and is not meant to diagnose or treat disease. Because our approach is individualized, it's important to not apply this information without first consulting with your healthcare professional. And now, here's Dr. Jim.
International Self-Care Day, July 24th. Are you ready? Are you ready? That day is not about health spas and pedicures. Today, we're going to actually dive deeper. It's really about true self-care. Listening to your body, giving yourself the gift of health in every way possible. So let's explore what real self-care actually looks like. Welcome back to the Dr. Jim Cares podcast. My name is Dr. Augustine from Head to Wellness, and today we're going to be doing a deep dive on self-care. The month of July, and specifically July 24th, is International Self-Care Day. So let's break this down and speak more about this particular important day because we need to raise awareness. Awareness is important to people getting healthy and staying healthy. So let's talk about it. It's actually not a luxury like going to a spa. It's actually a necessity. So let's break it down actually. What would you think about this? Physical health, let's start there because most people don't take care of their physical health. They just live life to its fullest, do whatever they want to do, and then eventually things start to break down and they have problems, health problems, and they start to realize that, well, I guess I'm just getting older. And they start to buy into that thing when doctors will say, well, you're just getting older because these things are developing now, and or it's genetic. If that were the case, what can you do about either one of those two? Not anything. You can't change your age, and you certainly can't change your genetics. So you're dependent on drugs and surgery, aren't you? And most people will wait because we've been brainwashed to think you only go to the doctor when you have a problem, and then they give you some sort of medication, and they're so darn busy because they never fix anything. That's why there's so many people there. And as soon as you start feeling better, you stop the medication or you run out of the medication and everything is just fine when actually it's not. The big thing about this whole day is to focus on putting into place, first off, taking it serious and putting into place lifestyle changes that can last you the rest of your life. Do you think that people that lift weights 4 to 6 days a week and build lean muscle on their body, they can just do it and then stop? Well, absolutely not, because guess what? They'll lose that lean muscle. They will start to shrink up. And why is that so important? Because it affects everything in your body. And I'm not saying you need to work out and lift weights 4 to 6 days a week. I'm just saying this self-care day we need to bring awareness to everyone out there so that you can not only get healthy, and let's get you to stay healthy till you don't want to be that way, till you want to die. 80s, 90s, 100, right? The body's originally was designed to live to be 120 at least. So let's talk about that. How do you do those things? Is it something that's genetic? No, it's not. It's something that we need to put into place, certain disciplines. So physical health, let's talk about that. Number one, nutrition. Eating real, fresh foods, not packaged, not fast food, because as you know, this society is such a quick fix society. You can go down the street and have food within 5 minutes, if you want to call it that. And let's talk about, so eating real, fresh foods is absolutely preferable. Also, an anti-inflammatory diet. Basically, you want to have protein and good essential fats every meal that you eat. Why? Because it helps to stabilize your blood sugar. Well, why is that such a big deal? It's because blood sugar is at the crux of heart disease these days. Statistically, people are smoking less, and so the only thing left is starch, sugar, and alcohol. You do those things and you do plenty of them, and things will develop. You will have prediabetes, then diabetes, then you're into heart disease. High blood pressure goes along with that. And so those things are a problem. So as far as your diet's concerned, the healthiest way to eat, the most anti-inflammatory diet available is the carnivore diet. That's only eating animal protein and animal fat. And so why is that such an essential thing to do? Because people say, well, what about if I just do keto? And I don't really believe in that because I want to be vegetarian, fruits and vegetables and all those things. So let me tell you about that. Fruits and vegetables have plant toxins in them or defense chemicals to protect them from being eaten by pests, meaning bugs, as well as animals. And certainly, and most people will say either they themselves or they know of somebody that if they eat broccoli or cauliflower, they're going to have bloating and gas, guaranteed. And it's not because they have gastrointestinal problems, it's because of the defense chemicals in fruits and vegetables. And also, those nutrients that are in there are less bioavailable than in animal protein and animal fat. Way, way more bioavailable. And the carnivore diet, like I said, is the most anti-inflammatory way to eat. Number one. Number two, it doesn't spike your insulin. Insulin is the critical hormone that when it spikes, it goes up and it stays up and it remains up because overall the standard American diet has way, way, way too much starch and sugar in it. It becomes a big problem. And one out of three people today are pre-diabetic. That's such a huge number. 1 out of 3. And why is that so important? Because heart disease, it creates heart disease, and that's still the number one killer today. So fresh, nutrient-dense foods, preferably a carnivore diet, because you're putting in essential amino acids and essential fatty acids that work, that just help your body to be massively healthy. Exercise, number 2, exercise. Let's talk a little bit about that. Regular exercise, activity in your body is essential. It's essential. And this is so cliche. People think, oh, yeah, I've heard that before. Yeah, I've heard that before. But the problem is we never actually do it. We never actually get out of our cubicle, our cubbyhole, our home once we get off work, get off that couch and go do something. So I challenge you just to go walk. If you could walk 30 minutes a day, great place to start. You will feel and function so much better. Our bodies were designed to move. Matter of fact, you would be absolutely amazed at what your body could actually do. But getting some sort of physical movement into your body is critical. It's essential. It can be Zumba. Zumba doesn't seem like you're exercising. It seems like you're out dancing. And so I try to put a twist on it and have people do things that they actually enjoy. Some sort of physical activity they actually enjoy, such as doing Zumba. Another thing you could do, and I just got into this myself, it's so incredibly fun, is pickleball. Pickleball, it's not that aggressive. It's not as aggressive as tennis. It's sort of a somewhere between ping pong and tennis. So it's not as aggressive as tennis, and you can play at your pace. So you can just start off, and it's fun. My birthday was this past weekend, and ever since the 4th of July, I've been playing pickleball every night till like 10:30 at night. It is so addictive. Probably 2 to 3 hours of straight of just playing pickleball. It's a blast. So Zumba, swimming. What about just simply walking in nature? My thing is I love to go backpacking in the mountains, love to go hiking and backpacking. Very difficult to walk uphill in altitude, so I dare you to go try that. It is very, very difficult to do that, and so it keeps you cardiovascular from that perspective, keeps you very healthy there. It exercises your full body, and it's a blast. And being in nature really does help out your heart and soul. It really tends to restore you. There's a whole other video I did on something called forest bathing. I recommend that you look that up. Forest bathing. It's a video I did on that, and it's when you go in nature or you just go outside from being in your house, cooped up in your house, just going outside in the backyard or taking a walk in a park, you will feel so much better, not only physically, but mentally, emotionally as well. So wonderful, wonderful things to do. So far we got nutrition and we have exercise. Another thing that you've probably never heard of, it's called biocranial. Biocranial. It's a way to jumpstart and improve brain function. 80% of your nervous system is above your spine. It's actually all inside your cranium here. You have 22 movable skull bones, and they should expand and contract, expand and contract. The problem for us all is over contraction. We don't get enough expansion. So imagine that your skull expands and contracts just like your heart and your lungs do, just not nearly as much, but we have too much, we have over contraction. So biocranial is a very deep but very significant stretch to very precise musculature that attaches to the back of your skull. And in so doing, we do it on both sides, but in so doing, it will expand open your skull bones, which jumpstarts and improves brain function. You want to do this. Why? Because your body is controlled and regulated entirely by your central nervous system. So what if we can improve your central nervous system? Then guess what else improves? Your body, your health. Fabulous thing to do. No side effects or risk to doing it whatsoever. And it's an amazing, amazing tool. This is is not the same at all as cranial sacral therapy. Completely different. Number 4, cellular health. Your cellular health is very, very critical, and it's probably one of the most significant and important things that you could look at. And there are ways to measure it. One test that you could do is called we have a scanning technology that we use here that directly measures cellular health. Another one is an organic acids urine test, also known as OATS or OAT, organic acid urine test. So it's a special urine test that you provide a sample, and what's in your urine is what gets dumped out of your cells into your urine because it can't complete this Krebs cycle or the citric acid cycle. And so these primary or these secondary metabolites in the process, you get larger amounts that get dumped into your urine because you don't have the nutrients necessary to push them to the next step. And ultimately, in a Krebs cycle, you get to the end and your food and nutrients will ultimately create energy. So your body has energy. You have 37.2 trillion cells in your body, and every cell back in the day in cellular science, when they were studying cells, they discovered that our bodies are electrical. And your cells actually have a measurable voltage of 70 millivolts. In every disease process, condition, problem that our bodies can run into, there is always a loss of charge inside the cells. So imagine that normal cellular energy is at 70 millivolts. And painful inflamed tissue, the cell charge drops down to 50. If you have cancer, it's way down to 15 millivolts. So what if you could take those organ systems and tissues and charge them back up? What if you could put them into a pulsed electromagnetic field of energy and charge them back up to 70? What do you end up with? Normal, healthy tissue that can respond to your nutrients. Because what people find these days is that no matter what they do, they just don't improve. They don't heal. They can't heal. Nothing's changing. They're taking the most perfect, pristine vitamins and herbs on the planet. They're eating the most perfect and pristine diet, and nothing seems to change. And classically, what I've discovered about 18 years ago is that your cellular health is probably at the causal level of that. So discovering and measuring your cellular health is a critical thing, and then doing something about it. And what you do about it is called high voltage pulsed electromagnetic fields, also known as PEMF. But it has to be high voltage. Makes all the difference. So your cellular health is a critical factor. So for physical health, we got 4 items: nutrition, exercise, biocranial, and cellular health, and doing something about cellular health. What about mental and emotional health? Mindfulness, number one, mindfulness and meditation. Practices like mindfulness and meditation help you reduce stress, increase mental clarity. Even a few minutes a day can make a big difference. If you own an Apple Watch, maybe you have one of these. Sort of foundationally at the center of Apple Watches is mindfulness. It's nice to be reminded about being mindful of things, being more aware of your physical health, because you really do need to make your health a priority. Really do. Like, it's a daily thing, and it's so critical and central to everything else, because if you do not have your health, you have nothing. You can't function. So your health is critical and essential. So mindfulness and meditation. Number 2, deep breathing. Deep breathing is absolutely phenomenal. There's a piece of technology that I use. It's a testing technology. It's called heart rate variability, an EKG-based test. Part of that testing is deep breathing. It's called a Valsalva maneuver. You'll take a deep breath in, hold your breath, and pressure, bearing down with pressure for about 10 seconds. And then the last part is deep breathing. And when you start deep breathing, you immediately influence your heart function, because you're influencing what controls heart function, which is your autonomic nervous system. Your full body physiology will immediately change. So when you feel tired, fatigued, terrible, yucky, poopy, all those bad things, immediately, if you can remember this, immediately start taking deep breaths. Not too quickly. Deep breath in, pause for a second or two, blow it all the way out, pause for a second or two. And just do that about 10 to 20 times. I recommend doing 20 deep breaths in the morning, first thing when you wake up. And if you can do it in the midst of morning sunshine, morning sun is really, really good to really help you to reset your circadian rhythm, your cortisol levels, so you actually have energy during the day, and you go to bed and you sleep well at night. So really, really important. Deep breathing, 20 deep breaths in the morning and then 20 deep breaths at night would be spectacular. And as much full body sun exposure as you can get, the better. Why? Because in the morning hours, you won't be burning your skin, and you'll be out there for 10, 15 minutes or so. Beautiful, raises your vitamin D levels that affect everything in your body from a good perspective. So deep breathing, critical thing to do. And of course, biocranial, also for emotional well-being. So by expanding your cranial bones and optimizing your nervous system function, biocranial can also support mental clarity and emotional stability. So this really helps you balance your body and mind. It's amazing how this works. And typically after a biocranial, people are really calm, because what I found in doing heart rate variability testing is that people's sympathetic fight or flight stress nervous system is way too high, and their parasympathetic, which is the rest and digest side, is way too low. So in doing biocranial, it brings that sympathetic nervous system down, calms you, brings your parasympathetic up higher. I've done this with people that are so really extremely type A, and they have such amazing amounts of stress. We do a biocranial, I let them just lay there afterwards. They go right to sleep. It's amazing. Totally shifts your emotional well-being and stability, and makes you calm and relaxed, and it's wonderful. Some other lifestyle choices that are really spectacular would be sleep. Sleep hygiene is a critical factor. If I do not get sleep, I get anything less than 7 hours of sleep, I am not so nice. And I'm short-tempered, I'm impatient, I'm brain fogged, not a nice guy. I need my sleep, and I make sure that I get that. So sleep hygiene is really, really important and essential, and it should be a fundamental thing for self-care. Try to establish a really good regular sleep schedule. Try that morning sunshine. Try moving your body during the day, And even try taking 2 things at night before bed. Not melatonin, because taking melatonin on a regular basis will create rebound insomnia. But supporting your liver before bed, taking a really good whole food liver supplement would be good, but also magnesium. And I also like to use a whole food magnesium complex that has a bunch of different forms within it because it's made out of food. Those things an hour before sleep make an amazing difference in your sleep and depth of sleep. Sleep quality is just amazing. Number 2, lifestyle change, is hydration. Hydration. You need to hydrate. And most of the time, try this sometime when you're like, I'm just tired. I don't feel like going and I don't feel like doing that. Drink a glass of water, and I bet you immediately it will change. Drink that glass of water and be like, I feel like going to do something that you kind of put off because you were just too tired. Hydration is such a big thing. People walk around all day long dehydrated. So drinking water is really essential. How much water should you drink? Well, start off with 32 ounces and work your way up to maybe 64 ounces a day. Remember that thing that your mom or grandmother used to tell you? 8 glasses of 8 ounces, 8 glasses of water a day. It's a good thing to work up to. But hydration is critical. But something about hydration today is a problem. All of our water that we drink is actually very deplete of minerals because it's filtered water. There's nothing wrong with it. You want to make sure that you pull all those bad things out of your water, but then make sure that you put it back in, put the minerals back in. And you can take a supplement. A whole food mineral supplement is a good thing for you. Why? Because the minerals are a catalyst for every biochemical reaction going on in your body today. So hydration, minerals. What about then listening to your body? Listening to your body. So doing regular checkups. You can do them with your doctor. Get your annual blood work and exam done. I definitely would recommend for ladies to do thermography, breast thermography, which is there's no radiation at all. Super sensitive testing. Spectacular. And if anything's found there, then you continue forward into medical procedures. But regular checkups are essential and a really, really good thing because it keeps you mindful. And just remember, though, that most medical tests are really designed to test you for disease. And what if you don't have disease, but you have dysfunction? Typically, medical tests don't test for that. And so another great recommendation is you probably need somebody who's also in holistic healthcare or functional medicine. That's what we do. That's what we do in our office. So critical thing, regular checkups. And then, of course, responding to your needs. Pay attention to your body, what your body's telling you. If you're feeling fatigued, it might be time to rest and recharge. It might be adrenals. It could be some gut inflammation. You might be eating some foods that are making you overly tired. There's a whole array of causes. Another big thing about health care is to look for root causes of your condition. Not just, do enough testing to put a label across your forehead. Oh, you have hypercholesterolemia, you've got hypertension, or you've got these things. For instance, if you have high blood pressure, certainly medication can lower your blood pressure, but what about finding out what's causing the high blood pressure? Wouldn't that be even better? Because if you work at that level, then guess what? It resolves and goes away, and you don't need to be on medication. There are times when people definitely need to be on medication, but I would suggest that you get tested, be mindful of what's going on in your body, and then essentially, and so because most people are way too much stress going on in their lives today and way too uptight, find ways to release that. For me, it's going to the mountains and backpacking in the mountains. Being in the forest totally resets me for the following week. So responding to your needs is a good thing. Most men out there, men have a pride issue. You don't go to the doctor until it's crisis time. Better to go test and not guess, and listen to your wives or listen to your significant others to say, maybe I should go get tested. Maybe I should go get checked. Do some testing, do some checking, be mindful of your health, and build and develop a routine or a discipline for your body to be healthy, considering these things that we just talked about. Holistic approach to self-care, holistic health, really, really important. Considering holistic health is kind of a major thing because we look at the body as a whole because you can trace it through the body. Here's a problem. Here's something that's brewing that's the ultimate cause of this way up here. So we want to be able to fit all that together so everything changes, improves. So holistic healthcare is really, really essential. So it includes everything from as far as now what do you do on that side of things is proper whole food nutrition and herbs. Of course, neurologic care, because what controls and regulates everything in your body is your central nervous system. Unfortunately, you don't see that being offered. We do this, and this is why what we do is so unique in our practice. And just remember that the real doctor for you is not anybody except you. It's all driven, we like to say that it's from above down, inside out. Above, down, from an inside out. That's how your body actually works and functions, and that's how your body actually will heal. There are integrative therapies and integrative things that you can do: acupuncture, massage, chiropractic, and biocranial health care to support your overall health and well-being. And like I said, testing is probably the best thing to know. You do some testing that's really, really essential, and then you go do something to improve things in your body. Then you go and retest to see if it's been effective. Because there's all sorts of things out there on the internet that claim all kinds of things that can be spectacular, but how do you really know? Test, go do something about your health and wellness, then go retest to make sure that it was helpful for your body. So in conclusion, the ultimate self-care goes way beyond surface level treatments. It's about responding to your body's needs and prioritizing your health in every aspect of your life prior to disease showing up so that you'll never get there in the first place. Wouldn't that be better? So on this International Self-Care Day coming up, July 24th, give yourself the gift of health. Consider these things. Thank you so much for watching. Hopefully you'll like and subscribe to my channel. Appreciate that. That would be great. And hopefully because this information is very, very useful to you. I'm on social media, YouTube, Facebook, TikTok, and Instagram. I'm also on podcasting, Apple, Spotify, Podcasts, plus all those platforms that have podcasting available. Hope this was helpful for you. And if so, let me know. I'd love to hear your comments. And we will see you all next week.
Thanks for joining us on your journey to wellness. Join us next time for more information and education about your health. And feel free to contact Dr. Jim on social media or at his office, Ahead to Wellness in Buena Park, California.